All right, let's get a report on this patient.
Okay, this here is Miss Candy Kane.
Hey, Miss Kane.
Hey.
She came in last night having some nausea, vomiting, pretty severe abdominal pain.
You still throwing up?
A little bit.
Okay.
We treated her with some Phenergan for her vomiting. It's held her for a while. She's really starting to have some pain again, so we'll probably need to dose her again soon. She does see an infectious disease doctor for her HIV.
Wait, hold up. You got the HIV?
Mm-hmm.
Y'all been using gloves and stuff when you stick her?
Well, of course, we use standard precautions with every patient.
All right, well, how'd you get that? You do drugs or something?
Yeah,
You got any track marks or anything?
probably. Been about 10 years.
Well, me and you gonna have to talk about this after we done.
Excuse
This
us, Miss
leper
Kane.
stuff, I
What do
ain't.
you mean?
Well, I mean, look, I gotta do extra stuff because if you got to, I'm not getting what it is you got.
Let's go talk about this. We'll be back, Miss Kane. Hold
Okay.
on just a minute.
Nurse,
What?
I just needed to talk to you about something else.
What you need now?
My boyfriend just said he was on his way up here.
Okay.
I don't want him to find out about...
He don't know already?
No.
You got to tell him that kind of stuff. You can't just be going around throwing your body around on him and stuff and not. You're gonna wind up getting him infected.
Miss Kane, we'll be back.
I'll be back in a
We
minute.
won't say anything to him, okay?
Thank you.
Look, I ain't treating her.
Bob, you can't treat your patients like that. You have to treat every
She's
patient.
like a dang leper. See, I'm gonna wind up getting something because she's got it.
No, you treat AIDS patients with
I
standard
ain't treating her.
precautions.
I
like
forget
all
that.
your-
I'm not treating her at all. I'm done with this. I'm
Come on,
not.
Bob. I think we should just talk to our supervisor.
Well, let's go talk to her then.
Come in.
Could we talk to you for just a minute, please?
Sure.
Yeah, she got a bunch of horse crap she wants to tell
Bob is
you.
acting very unprofessional, has treated Miss Kane horribly. And he cannot act like this. He cannot treat his patients like this.
But look, she's got the dang AIDS. I ain't wanting to get that crap.
So you're being mean to a patient because they have AIDS.
I ain't being mean to her. I just ain't gonna treat her. I mean, I got kids at home. I ain't carrying that home with my kids.
You cannot refuse to treat a patient just because they have AIDS.
The heck I can't. You watch this. I ain't going in there.
No, you cannot do that. You are discriminating against a patient. Look, AIDS.
Look, y'all
Not
put
gonna
me at
catch-
risk.
Okay, well, you cannot refuse this. And if you do, then I'm just going to tell you, you're going to have to turn in your badge because I'm not getting a lawsuit for this hospital because you want to act that way and refuse to treat a patient with a disability.
How's that gonna be a lawsuit? I mean, we have the right to protect ourselves. That's the reason,
We
y'all.
use standard precautions with every
Yes,
patient.
under, hold on one second. Right here, the ADA states that you cannot discriminate against a person with a disability. And in this case, they do have a disability and you are being unfair and unequal. You are not going to catch AIDS if you do your treatment the right way. And this is in your scope of practice, so you cannot refuse. And if you do, I'm just going to have to take your badge.
Well, you just gonna have to take it because I ain't working here putting up this mess. All right, let me get a report on this patient.
Okay, here we have Miss Candy Kane. She came in with us last night with nausea, vomiting, and severe abdominal pain.
Okay.
We treated her vomiting with some Phenergan last night.
How did the Phenergan, did it work for you pretty well?
Did.
Okay.
So she had a pretty good night with that. The infectious disease doctor should be around to see her today. She's HIV positive. She's on routine meds for that and has been for several years, so it's well managed.
Okay.
Any questions for us, Miss Kane, as of right now?
Mm-mm.
All right, well, let me go out here and I'm gonna check your lab work and stuff and see where it's at and look at your med orders. Then I'll be back here in just a minute and we'll get everything going and make sure you're all set up and I've got everything I need
Okay.
to get you better and get you out here, okay? All right, just call us if you need anything.
Actually,
Oh, okay, I'm sorry. Yes,
my boyfriend is on his way up here,
okay.
and I don't want him to know.
Okay, so you haven't told your boyfriend yet?
Mm-mm.
Okay, well look, now us, that's not our job to tell, we don't give out any information unless you tell us to give information to someone. So we're not gonna be telling him anything, okay?
Okay.
If you want him to know, that'll be your job to tell him instead of ours.
Okay.
Alright, so we're gonna protect your rights and your privacy and we're not gonna distribute any of that information.
Okay, thank you.
Okay, I'll be back in just a minute. Look, I look forward to treating this patient because I've never treated anybody with
Yeah.
this condition before.
Right.
But I'm a little bit nervous. I've never, am I supposed to wear a glove and gown and stuff when I go in and,
No, with AIDS
Treat her.
patients, you just do your standard precautions that you do with every single patient. Always use your gloves and things like that.
okay, I'm just a little bit extra nervous because I've just heard so many bad things about it. I'm just a little bit anxious, so I need to
Yeah.
find out a little bit more
Yeah.
before I go back
I
in
think
there
we
again.
should just talk to the supervisor. Maybe she can put your mind at ease a little bit.
Well, let me ask you about this. What,
Mhm.
like, she's not wanting to tell her boyfriend. Does the law not require, like, us to tell her boyfriend that she's got it?
Unfortunately, the HIPAA laws protects the patient's privacy, so we can't say anything to him. It will be up to the patient.
Well, that's gonna be awkward though, ain't it?
Yeah, well, let's just talk to the supervisor. Maybe she can offer some advice for you today.
Okay,
While he's
all right,
there.
let's do that then.
Okay.
Come in.
Hi.
Hi.
Bob and I wanted to talk with you. He's got some concerns about treating this patient. Pain.
Okay. Why are you concerned?
Well, this is just a new experience for me. She has HIV, and I've just never treated anybody with HIV, and I'm just a little bit nervous.
Okay. Yeah, we don't get a lot of HIV patients, but there's nothing to be nervous about. HIV's only spread through blood, bodily fluids, and it has to come in contact with another mucous membrane or be injected into the bloodstream. So as long as you use standard precaution and of course, wash your hands like you do with every patient, wear gloves before you touch anything, do with every patient, and be safe with your injections and make sure you don't stick yourself. Everything
What
should be
about like
fine.
if she sneezes on me or something like that? Well, can I catch it that way?
No, it can't live outside of the body, and it would have to go like she'd have to sneeze and it have to directly go into an open wound or something like that. It's very unlikely that
Well,
would
good, because I don't have any open wounds, and I'm gonna be wearing my gloves anyway, so I don't have anything to worry about with that then.
Yeah, you should be fine. As long as you do what you're supposed to do, then you're not going to catch anything. And don't be sensitive towards her. I know that's a sensitive subject for her, probably.
Right.
So make sure you're not being
Yeah,
discriminated.
she really doesn't want her boyfriend to know.
Okay.
Yeah, that's another question that I have. She told us that her boyfriend's coming to see her, but she hasn't ever told her boyfriend that she has HIV, and do we not have to tell the boyfriend that
No,
she
if
has
the
it?
patient does not want you to tell the boyfriend, you cannot tell the boyfriend. You can't disclose her information unless it's to another healthcare provider that's going to be included in her care.
Okay, I'll be happy to do that. Well, thank you for spending time with us and
You're
getting us
welcome.
making me feel more comfortable. Hey, Miss Kane, I
Hey.
see your basin's down here. Let me get this up for you and hand it to you again. Have you been having any more nausea today?
Mm-mm.
So that Fingergrin's working pretty well for you. Well, I went and checked your lab work. I'm gonna give that to you just in case you do get nauseated again. And everything looked like it was in a good range right now. I believe we'll be able to treat you and get you feeling better. I do have one concern I'd like to talk to you about though.
Mhm.
You asked me not to say nothing to your boyfriend, in which I'm not going to.
Mm.
So I know it's an uncomfortable situation, and we don't. Y'all might just want to sit down and just have a little discussion together and find the best way. You might want to get some material and read it. Well, I can provide you with some material if you need some,
Okay.
and maybe look up on the internet, maybe ways to approach this and be able to talk to him, because we don't want to put him at risk also.
Mhm.
All right, let's have a review today of some of the things that happened in our scenario. We'll start off with the first one where we had Bad Bob. So do you have some things to interject on that?
So the things that Bad Bob did wrong, he was very rude and unprofessional to the patient. He made Miss Kane feel very uncomfortable.
Sorry about that.
It's okay, Bob.
He also violated HIPAA by yelling and talking loud for people who were out in the hallway or walking by to hear. He should not have asked Miss Kane how she got AIDS or HIV. He needs to be educated on the disease process. And also, you cannot refuse care to a patient based on their illness.
You know, going with that, was able to pull up some information from www.ada.gov about the Americans with Disability Act, and in that website it covers a lot of the scenarios dealing with healthcare providers and how you treat this person. Like, you can't just push a person off onto another provider because they have HIV. We have to treat them, and we treat them just like we would any other patient. Do you have anything to add?
Okay, well, let's talk about what you did right. You identified the patient. It was a professional report. And then you used standard precaution like you would on any patient. Use gloves before you handled her equipment or what she had been using to vomit in.
Yeah, normally I wouldn't put on gloves just to handle anything, like if I was going to pull up her cover or something, but that being a vomit basin and she had been having nausea would have been the reason that I would have used gloves in that situation.
Okay.
Do you have anything you'd like to add?
Oh, yeah.
Okay.
Okay, good Bob made me feel comfortable. He didn't judge me like Bad Bob. And he established trust with me. He educated me on HIV safety and allowed me to have autonomy with telling my boyfriend. He didn't violate HIPAA.
Yeah, and in this situation we had several things where I had concerns and I didn't know what I could or couldn't do, and I found out a good way to educate myself. You can go to www.cdc.gov, and there's a lot of information on there pertaining to healthcare providers and treating patients that's got HIV, and it answers a lot of concerns for you about whether how blood is spread. Like, one of the things I found out is even if you do get stuck with a needle from an HIV patient, you only have a 1% chance of getting it yourself. So the risks are very low when dealing with these patients. And that's about all I have. Y'all have anything else to add?
Right, and instead of yelling and acting out in the hallway like you did in the first scenario, you decided to just bring your concerns into a private area with your supervisor and handle that in a better way.
Which we all know is what you should do. Y'all have a good day.